So after looking at the static scapular assessment, we're going to move into a dynamic scapular assessment. Gabriel, Ryan, and Dre, call me Gabe, not Gabriel. So we're looking for smoothness of the scapula. So we're looking at upward rotation and downward rotation. Is it going up smoothly? Is it going down smoothly when you're going into the full body movement? Also, if the scapulars are symmetrical, we're looking at, again, at the superior angles and inferior angles of the scapula. We're checking for either winging or tipping of the scapula. And there will be a little bit of a timing mechanism with this test. So for every 2 degrees of glenohumeral movement, there's 1 degree of scapular movement as long as with it. So for the first 30 degrees, from 0 to 30, we're just using the glenohumeral joint. From 30 to 150, we're using both glenohumeral joint and your scapula. And from the last 30 degrees, from 150 to 180, all glenohumeral joint or shoulder. So we're just going to take those into consideration, and we're going to look to see how Dre moves. So this test can be done in 2 different positions. One, you can be in flexion and extension. And secondly, we can do abduction and adduction, coming back to neutral. So Dre. Okay, and we're gonna do abduction. So thumbs up, lift those arms up. It's nice and smooth and slowly, all the way up. Good, and back down, and we'll just keep going. Keep doing some reps. I know your shoulders will burn. So with Dre, as she's going into that 3rd repetition, keep going. Her right side is relatively smooth with upward rotation and downward rotation. However, on her left side, her left scapula, it's smooth going up. So she's smooth upward rotation, but as she, at 90 degrees, coming back to neutral, there's a tremor and a little bit of lag from that scapula. So as we see from here on down, it's more like tick, tick, tick instead of nice and smooth. They are symmetrical, so we're here and here in height. With her, she does have some winging present and tilting, as we've seen in her static scapular assessment. You see they're nice and bunched up, but here we're present with winging and tilting. Good, nice and good. Shoulders burning? Mm-hmm. And you can go ahead and relax, Dre. So definitely take this test in consideration when you're looking for scapular rhythm, and pay attention to how the glenohumeral joint and the scapula are cohesive in bringing that shoulder all the way up to 180 degrees.